Hello, how are you? This is part 2 of the American drugs names versus generic drugs names. So since I'm working in the hospital as the registered nurse, and I have encountered so many of the medications, especially some common medication for common medical patients, which I think will be very useful for you to know if you are a new nurse in the United States, because I used to work in different places, different country, but when I come to United States, that's where I struggle at. So I feel you, buddy, and I think this video will be very helpful if you are in the same situation like me. So one of the medicine that I have already done a video like this, part 1, so go check that out. And this time I have a few other medicine that I have not gone through yet. And this medicine is called promethazine. Promethazine is very common to give it to patient who has nausea and vomiting. And promethazine is the generic name. In the United States, we call it Phenergan. So let me know if I'm pronouncing it right, Phenergan or Phenergan. So it's spelled like Phenergan. It's usually coming like injection, intramuscular injection. So let me know how you pronounce it, okay? Phenergan or Phenergan, okay? But the generic name is promethazine. I will have all that spelling right here for you. So this medication is the anticholinergic and also antihistamine. So it could be also treated for allergic reaction. So Phenergan, promethazine, okay? Another medicine I have come across is sulfasalazine. Sulfasalazine is generic name, and the brand name of it is Azolfidine. So do you call it sulfasalazine or Azolfidine? How do you call that? It comes in a tablet. So that medicine can be treated for ulcerative colitis and Crohn's disease and any other IBD is inflammatory bowel disease. So it could be treated for ulcerative colitis, UC, or Crohn's disease, or IBD, inflammatory bowel disease. Sulfasalazine, Azolfidine. Another medicine, again, I have come across for my patient who has ulcerative colitis is adalimumab. It's long and it's tongue twisting, I believe. Adalimumab. Okay, that's generic name, and the brand name is Humira. A lot of people just keep calling Humira, but that's brand name, and you might see in the TV like advertising Humira. But if somebody said adalimumab, you can be like looking confused. So adalimumab or Humira, it is usually come in subcutaneous injection. It is to be treating for ulcerative colitis, Crohn's disease, rheumatoid arthritis, and those inflammatory bowel diseases. And usually patients are given themselves every week subcutaneous injection. Another medicine I would like to talk about is sodium zirconium cyclosilicate. Very long name, so a lot of people call that medicine Lokelma. That's a brand name. Lokelma is a brand name. Sodium zirconium cyclosilicate is generic name. That's the medicine to help reduce the potassium. If the patients have the potassium of 5.0 and more, that could be called hyperkalemia, and they're starting to give that medicine to the patient. And that medicine comes in a powder packet, 10 gram. So the study has shown that this medicine has the slow onset, so it should not be using for the emergency treatment. But if the patient has the high potassium for a chronic problem, like patient is in SNF, skilled nursing facility or in nursing home or at home that needs to take that medicine for a long term, it is helpful. Sodium zirconium cyclosalicylate or Lokelma. So there is another medicine called sodium polystyrene sulfonate. It is also known as in a brand name called Chiasalate. So Chiasalate is also to treat the hyperkalemia, high potassium. So this medicine is shown to act faster. So a lot of people use that Chiasalate better, more than Lokelma. However, you need to know both. So sodium polystyrene sulfonate is Chiasalate. Sodium polystyrene sulfonate is also called Chiasalate, or Lokelma is called sodium zirconium cyclosilicate. Okay, sodium zirconium cyclosilicate, Lokelma, sodium polystyrene sulfonate is Chiasalate, both to treat hyperkalemia. There's another medicine I have come across, which is to treat the angina, the chest pain, or high blood pressure. It is deltiazem. Deltiazem is the generic name, but there are a few brand names that I come across, which is Cardizem or Katia XI. So deltiazem, Cardizem, Katia XI. So deltiazem is a generic name. Cardizem is brand name. Katia XI is also brand name. They are to treat for the high blood pressure, angina, and by relaxing the blood vessel. It is also belongs to the group of calcium channel blocker. So calcium channel blockers essentially acts on the blood vessels and relax the blood vessel. Thereby blood pressure's workload gets decreased and the lower blood pressure as a result. Another medicine is called phenol, and thus another name is Chloraseptic. Phenol is the generic name, I believe. Chloraseptic is the brand name. I think phenol is even easier. Phenol or Chloraseptic, that is 1.4% of the spray to the for the throat is to numb, is a numbing agent to the throat if the throat is having any irritation. So phenol or Chloraseptic is to numb the area of the irritation area of the throat. Another very common medicine is spironolactone. Spironolactone is the generic name. The brand name is Aldoltone. Spironolactone or Aldoltone. Spironolactone or Aldoltone. That's usually in tablet, but it's also have different form of the medicine. So spironolactone is to treat for it can be treated for high blood pressure, heart failure, edema, swelling, and also kidney problems. So that medicine is also called potassium-sparing diuretic. Diuretic will make you go to bathroom and keep losing urine, so you will keep going. It's also called water pill because it's like you keep losing the water and sodium. But that's good thing about spironolactone or Aldoltone is that it will still keep your potassium. That's why it's called potassium sparing diuretic. You will pass urine in which has sodium and water, so it will help you with the swelling and hypertension and edema, heart failure, and kidney problem, but it will keep your potassium. So that medicine is also helps with the heart problems and hypertension, edema, kidney problem. But there's another medication that I don't want you to mistaken with. That is Lasix and furosemide or Lasix, and that I already have in the previous video. So furosemide, Lasix is also a diuretic, but it will make you pass urine in which has water, sodium, and potassium. So Lasix will lose your potassium, but spironolactone or aldactone will keep your potassium. So it depends on what your doctor want to give it to you, depending on your sodium potassium level in your blood. So they may check your blood serum potassium level as well. And since spironolactone, aldactone is added on the aldosterone, and they might check serum aldosterone test as well. So one thing to note about spironolactone, aldactone is it can cause, like a common side effect of it can cause you a GI upset. So can cause like nausea, vomiting, pain in the abdomen, things like that. So make sure take it with food to reduce those side effects. Okay. Other than that, usually that medicine works in 2 to 3 days, spironolactone or aldactone, to reduce the blood pressure, swelling, heart failure, and kidney problems, but also will keep your potassium. So you're not going to lose a lot of potassium by taking that, but you will still lose a lot of water and sodium by passing urine. Okay, help me out on this one, okay? Because this is so common, so popular, but I still cannot figure out which one is the correct pronunciation. It is cetirizine. Cetirizine or cetirizine? Which one is correct? Cetirizine, and the brand name is Zytec or Zyrtec. Which one is correct? Okay, anywho, cetirizine is the generic name. Zytec is the brand name. Usually come in 10 milligram of the tablet. It is for running nose, watery eyes, sneezing, and itchiness. So let's just call one way not to confuse myself: cetirizine or Zytec. There is another medicine that a lot of people probably like it so much or addict to it. It is clonazepam or Klonopin. Clonazepam is the generic name. Klonopin is the brand name. Usually comes in 0.5 milligram of the tablet. It is the commonly used benzodiazepines medicine in the US, but benzodiazepine could be also used for like sleeping pill, but in US FDA doesn't allow to use it as a sleeping pills. But this clonazepam or Klonopin is very useful for like seizure, panic attack, like anxiety. So mostly the indication is for anxiety, panic attack, and seizure, not for the sleeping, but it has the big effect on the sleeping pill, big effect like a sleeping pill. But you don't want to give it to your patients, it's for sleeping. Okay, so it's called clonazepam or Klonopin. Another medicine is called duloxetine. Duloxetine is the generic name, and the brand name is Cymbalta. Duloxetine or Cymbalta is usually coming in the capsule, 60 milligram duloxetine or Cymbalta. It is to treat for depression, and also can be treating for anxiety. So be careful with any antidepressants medication that one patient's got some effect to it, and when they get better they might have like a suicidal thoughts because they got more energy to think about more stuff that they want to try to commit suicide. So be careful with any anti-depression medicine. After a week or two, when they're starting to have effect, they're starting to have suicidal thoughts. So duloxetine or Cymbalta. It also have a little bit of effect on the pain relief for chronic pain. So ask the doctor if the patient is prescribed for duloxetine or Cymbalta. Is that for treatment of depression or anxiety or the chronic pain, or where is the pain at, right? Duloxetine, Cymbalta, and be careful with the suicidal thoughts. Okay, duloxetine, Cymbalta. Another name of the medicine is fludrocortisone or Florinef. It is easier to call Florinef, but it is easier to remember what the medicine for by the generic name fludrocortisone, because that medicine is cortisone medicine. It is the type of a steroid. So we don't play around with any steroid. It has to be prescribed by the doctor. It has to be very careful with your immune system, because of any steroid can act on your immune system. So that fludrocortisone can also be treating for the replacement of the adrenal cortical insufficiency, and also it can lower the potassium. It is the family of medicine called steroids, so do not play around with steroids, and it has to be taken as prescribed. Fludrocortisone or Florinef. Fludrocortisone or Florinef. Adrenal cortical insufficiency treatment, and it is usually come in tablets 0.2 milligram. Fludrocortisone, adrenal cortical insufficiency treatment, Florinef. Fludrocortisone, Florinef. This another medicine is prednisone. Prednisone is another type of steroid, but it is glucocorticoid. So not only to be careful with the immune system being low, but also you have to be very careful about your blood sugar getting higher because of that prednisone medicine. So prednisone or deltazone. Prednisone is generic name, deltazone is the brand name. 10 milligram in the tablet usually. Prednisone or deltazone. Gabapentin, Neurontin, very common medicine, is for neuropathic pain. Usually come in the capsule, 300 milligram. Gabapentin. Here in the United States, all patients kind of know gabapentin or Neurontin, any of those two names, and they're very familiar with gabapentin or Neurontin for the neuropathic pain. And another common pain medicine that the doctor's been prescribing to the patients who has the pain score usually 4 to 6 out of 10 pain, so it's kind of medium pain, but it's more than a little bit of median. It is hydrocodone, acetaminophen. So it has hydrocodone 5 milligram and acetaminophen 325 milligram together. That's called NARCO. Okay, so hydrocodone, acetaminophen is too long. It's NARCO, that means two combination of these two medicine. It is a narcotic medicine, so it is control medicine. So it helps for the pain, but very careful. People can get addicted to that, and it is quite effective medicine as well for most of the patients. Another medicine I have here on my list is magnesium oxide. It is also called MAC-OX. So magnesium oxide or MAC-OX. Anything is fine. All of us kind of know by both names. So magnesium oxide is generic name. MAC-OX is the brand name. Usually comes in 400 milligram tablet. It is for the replacement of magnesium. Magnesium is good for your heart. If the heart is pumping too fast, like ineffectively, it can actually slow down the heart. It can actually like make the heart muscles kind of softer, like a rubber, and then can pump effectively but slower rate. Instead of pumping this, it pumps this. So your heart is more effectively pumping the blood with the magnesium replacement. If you need to, you can take it, by the prescription of the doctor. Another medicine is antibiotic. It is levofloxacin or Levaquin. Levofloxacin is the generic name. Levaquin is the brand name. 750 milligram that actually already mixed in 150 milliliter. Usually comes in a bag that we have to hang like a antibiotic, IV antibiotic. So anyhow, levofloxacin or Levaquin, and that is pretty strong antibiotic, and it's also like pretty rarely used unless it's the medication that is only choice for the patient. I might be wrong, but I have this medicine on many patients, but mostly those patients who are actually having the infection that hard to treat. So levofloxacin or Levaquin is the moderately strong medicine. One thing I learned about levofloxacin, Levaquin, is that it has the side effect to have a sunburn. So make sure your patients wear sunscreen, like as you should. That's for everybody, but she or he has to have a very specific precaution for that, because it can actually have a sunburn for the patients, and try to stay away from the sun. So that's one thing I learned. Levofloxacin, Levaquin. Another medicine is commonly prescribed to the patients with insomnia, like can't sleep, and also it has the effect of the antidepressant, because it is believed to be work on the serotonin level to be increased. The serotonin level is in your brain that actually increase the happiness. So this medicine is called Trazodone, and the brand name is Deserel. Correct me if I'm wrong. A lot of people just call it Trazodone. So let's just call it Trazodone. The generic name is easier, right? Generic name is Trazodone. The brand name is Deserel. Usually come in 50 milligram or maybe different other strength. I don't know, but one of my patients has it in with 50 milligram. Most of all the patients that I have on Trazodone, I usually ask them if those works for them, and they don't usually know that they work, and they just take it. But one of the patients has like really had a big side effect that when she take the Trazodone, she just like really dizzy, and she has to be in the bed. If she's starting to walk around, she just pass out. So just be careful with Trazodone. For some people, they can just pass out with that. So I believe that will make the medicine make them dizzy, or a little bit more than dizzy. That's scary to be passed out with the medicine. She's still taking it, but she has to be like lay down in bed, ready to go to bed before she take the Trazodone. So just be careful with that Trazodone. I usually check the blood pressure before I give that medicine, because I have that bad experience. So Trazodone or Deserel. And next medicine, I just newly learned this medicine that's called tacrolimus. Yeah, tacrolimus, and the brand name is Prograf. Tacrolimus or Prograf, it is come in the capsule 1 milligram, and usually the patients will be given like day and night, 1 milligram at night, 2 milligram a day, something like that, but it depends on whatever the prescription is. It is called tacrolimus or Prograf, and that medicine is anti-rejection medicine. If the patient has like kidney transplant, liver transplant, because it is transplanted, it is other people organ that in your body, so your body turn to do like the auto immune system that auto want to reject, this is not mine, this is something from outside. So the body try to want to reject on the organ that's being transplanted. So this medicine, anti-rejection medicine, helps you by lowering down the immune system, then your immune system won't like attack on the transplanted organ. So it has to be very careful if you or your patient is on this medicine, that your immune is kind of suppressed. You're not in the very high immune system, so you can get like flu or pneumonia, things like that very easily. So you can get sick easily. So you don't want to be like around sick people. You know, you don't want to have like fresh flour in the room because it has bacteria and insects in there that you can get all that. And you don't want to like eat raw egg, you know, like raw meat, things like that. So just be very careful if you're on the medicine like that. It is anti-rejection medicine, tacrolimus or Prograf. Okay, don't be alarmed with this outfit, okay? I'm a witch today. I'm about to go to a Halloween party with my kids to their school. There's one medicine that I keep forgetting. That is Fioricet, and that's the medication that with the combination of 3 medicines. So acetaminophen, butalbital, and caffeine. So those 3 combination of the medications that combine become one medicine called Fioricet, and that medicine is actually good for like a very bad migraine headache. So that is called Fioricet. Okay, let's just close this up with the medicine I just newly learned as well. It is called teriparatide. Teriparatide is generic name, Forteo is the brand name, but I think a lot of people call it teriparatide. It comes in 20 microgram for the subcutaneous injection. It is for those people who has osteoporosis, the weakenings in the bone. Like man or woman can have osteoporosis. Man or woman can get this replacement medicine. It is called teriparatide or Forteo for osteoporosis. So I hope you get some information. I hope I learned some information, and I will keep watching this video for myself. Mainly I do this kind of video for myself because I really like lazy to do some study, to be like repeatedly doing it. So what I do is I make video for myself and I put it on YouTube, and also I listen it when I'm like showering, about to sleep, or in the car, things like that. So I hope also to help other people who are in the same situation like me, trying to learn some medications, some pronunciation, some generic name versus brand name. So let me know any other medicine that you think is like commonly used in the United States and also not the same as it is named in the other country. Okay, and I might do another video because I have so many medicine that I want to actually learn and do the video like this, but it is not enough time. So please let me know, and please give me a thumbs up so I have some encourage to do more. Okay, thanks.